Hi, my name is Sam Slavin. I'm one of the internal medicine residents at MGH, and I'm recording this to answer some of the questions that have come up in the last few weeks about coronavirus, COVID-19. The first question that we have is, are the masks that we're being given really helping to protect us from COVID-19? The answer is yes. The masks that we get when we come to the hospital, they protect us in a few ways. They protect us from getting the large droplets into our mouths that carry most and noses that carry most of the virus. They also prevent us from touching our faces, which is really one of the main ways that we get infected is we touch something with coronavirus and then we put it on our faces near our mouths, nose, and eyes. They prevent us from doing that and help keep us safe in that way. Then another major way is many of us may have an infection but may not be feeling symptoms. We may come to work, then we cough or sneeze and could pass it to someone else, but if we're wearing a mask, we're helping to protect others. They are having a big impact. We're fortunate to have them. Together with that question, we're asked, does the virus stay in the air for a certain period of time? The answer is generally it lands fast and it's on surfaces. It's not hanging around in the air, except for about an hour or so after certain procedures. We'll talk about that a little bit more later. Next question is the protective equipment that we wear when we go into the rooms. Does that protect us from coronavirus, COVID-19? And yes, the answer is that protects us in a very effective way. The N95 masks that we're given to care for those patients protect us even from the small particles that stay in the air. Face shields and goggles protect our eyes, and we're covered by our protective gowns as well. One thing to emphasize is that while that equipment protects us very well when we're in the room, the virus may land on that equipment, so that the way we take that off, doffing, is incredibly important so that we don't infect ourselves by accident when we're taking that off. I know you've received training on how to doff, and I just want to emphasize that that is very important, doffing, how we take off the protective equipment so we don't infect ourselves by accident. Some of that equipment is being reused. We're cleaning our eye protection, and at the end of the day, we're sending our N95s to be sterilized. And we believe that reusing the equipment is safe. When it comes back sterilized, it's safe to use. Of course, if it is visibly soiled, if something lands on your mask, don't reuse it. You should be able to get another one for the rest of your shift. The next question that I've got here is, are we running out of PPE, cleaning wipes, bleach? You will know that we don't have as much available to us on a day-to-day basis, and we are being very careful not to overuse this equipment and to use just the amount that we need so that we do not run out. But right now we do have enough supply and we are not running out. We are simply being careful to conserve this equipment. Given that we know there will be an increased demand, we're using just the amount we need and no more. Next question is, do we know how long COVID-19 lives on surfaces? We're just starting to learn about this. We don't have perfect answers, but we know that yes, it does live on surfaces. Metal surfaces longer than cardboard surfaces, and this can be a day or longer. So any surface, especially door handles, things that are touched by a lot of people, we should be treating those as if they have the virus on them and being very careful if we do need to touch one of those surfaces to wash our hands very well afterwards. Next question that comes up is, do I need to wait an hour, 60 minutes before entering a room to clean it up or to provide food for a patient? And the answer is that 60 minutes is for aerosol generating procedures. So this is a relatively rare thing, but at the moment when a breathing tube goes in, if a patient is receiving a nebulizer, or the moment when a patient has the breathing tube come out, we say those procedures can generate aerosols. That's the tiny particles that float in the air, and we do wait an hour for those to land, essentially, before we say that there's no longer an aerosol. So if it's possible to wait 60 minutes after one of those procedures, we do, although our N95 masks should protect us from that as well. We just wait to minimize the risk. But in general, after a patient is discharged for a room, if you're being asked to go in and clean, one of those procedures is usually not done right before the patient leaves the room. You should be told if it did, and you should be able to go in and clean that room. Okay. Can our uniforms be a source of infection if we were exposed to a COVID-19 patient? So it's true that a virus could land on our uniforms. Now, if we're wearing a gown that's covering us completely, we should be protected, and we take that off correctly so that there's nothing left on our gowns. That being said, I would recommend that our uniforms, scrubs, whatever it might be, if there's a way to take that off before leaving the hospital so that it's not brought home, that might decrease the risk of bringing virus back out into your communities. We'll talk more about that in a minute as well. All right. How often should we be disinfecting common areas, doors, door handles, and the staff lounges? The answer is really as frequently as possible. The surfaces that we touch, places where we sit, those door handles, are going to acquire virus from people who are walking around the hospital without any symptoms. So the more that those can be cleaned, the better. And we're grateful for your cleaning those surfaces. It's going to help prevent disease. Okay. Shouldn't we be using bleach? So Virex has the word virus in the name, and all of our standard cleaning solutions do kill this virus, so bleach is not necessary. Next question is, what can we do to minimize the risk of exposure to the virus, especially for people with a history of pneumonia, diabetes? I would also add history of heart problems or obesity. All of these folks are at much higher risk. So what can we do? I think that being very careful about our standard precautions in the hospital is the best thing we can do. Using all of the recommended precautions on the door and taking them off, doffing them very carefully not to contaminate our hands, faces, or eyes. We'll talk more about how to protect family members in just a minute. What happens, here's a very important question, what happens if the hospital no longer needs me? Will I be paid? I can understand that concern. And you may be hearing about other hospitals that are cutting staffing and decreasing pay. Right now, you are needed. We are all very much needed in the hospital, and there is no reduction in staffing coming up right now. All of us, we need all hands on deck. We are all needed in the hospital at this moment. So, next question, what if a respiratory infection patient, what if a patient that we cared for tests positive for COVID? Are we safe? If you were wearing the right protective equipment, you're safe. And we believe that you're safe caring for that patient because we are now recommending the standard equipment that should be protective against any of these patients. And anyone who's being tested now, the recommended equipment is the maximally protective equipment with the N95 and the face protection. So anyone who is we're at all concerned about, we will have you wearing that protection. And coming up very soon, every patient will be tested from the moment that they come into the hospital. That will go into effect on Monday, April 27th. Okay, the next question I have here is, will I be paid if I'm home with COVID? So, yes, if you are home with COVID, you will be paid regular salary until your symptoms resolve. If you're home because you're sick for another reason, then it's exactly the same as it was before COVID, and you'll be using earned time or extended sick leave. There's no change from the pre-COVID time. What should I do if I get a fever, cough, or sore throat? So the app that you use to record your symptoms when you come into work, you should record those symptoms there and then contact occupational health, and they will guide you as to what to do. You could also contact your supervisor, but the primary contact should be occupational health. Next question, I work with someone who tested positive. Do I need to get tested? Right now, we're all wearing the masks in the hospital. We're all trying to stay 6 feet from each other if we can. If you have no symptoms and you feel well, you can continue coming to work. If you develop any symptom, you should contact occupational health and get tested. But we believe the risk is pretty low given the precautions that we're taking now. Okay, next, I have infants at home. Should I be exempt from going in those rooms? At the moment, everything that we know is actually that the risk to children and infants is very low. With the proper protective equipment, you should be able to go in the rooms, take off that equipment safely, and come out with a low risk of you being infected or of you infecting someone at home. We're also asked about if you have elderly family, an elderly parent, someone who lives with you, can you keep that person safe? Those people are probably at even higher risk, a much higher risk than children and infants. So in addition to doing all the standard precautions, that person lives with you, we would recommend trying to keep a distance. When you get home, many of us are informally taking off that set of clothing, putting it aside where it's not going to come in contact with anything in the house, cleaning yourself very well before putting on a set of clothes to wear in the house, and then trying to keep your distance. And of course, if you develop any symptoms, getting tested and looking into options for how to keep a maximal distance with anyone who's vulnerable at home, including options for you to isolate yourself even more completely if you do test positive. And you should ask about those if you do have a positive test. Occupational health can help guide you there. What changes have been made in the hospital since this pandemic started? So there have been big changes. We've canceled most of our elective surgeries, doing only the most urgent or time-sensitive procedures. And we've changed many floors that were surgical floors are now floors for taking care of patients with COVID. There have been big changes. The hospital has been busy to try to take care of these patients, and we've been fortunate that preparation has been paying off, and our patients have been doing well. How many positive patients are at MGH? So just today, there were 349 patients positive with COVID disease at MGH, and that number does appear to be leveling off. We're taking care of a very large number of the patients with COVID in Massachusetts. How long is this going to continue? We're all asking ourselves that question, and we don't know. This could continue even if we're, and I hope we are, seeing that flat part of the curve, that cases, we're not seeing a huge rise in new cases every day. We are going to be seeing a steady number of cases for a long period of time, and will probably continue through the summer and later this year to have restrictions on how we go out and how we care for patients. Those will very gradually, over probably 6 to 9 months, start to be lifted, but that doesn't mean this is behind us, and there may be another wave coming up in the future. So while I hope that in a few months we will start to feel that things are a little bit back to normal, we will be coming back to normal very slowly and very gradually to keep everyone safe. Last question is, how can the hospital afford to keep everyone at this time? And it's true, this is a financial crunch for the hospital, even though we're as busy as ever. Thankfully, there's a big stimulus from the government going to hospitals to help cover this cost, and that will help us be able to continue providing excellent care and keep our staff that's absolutely necessary during this time. I'm happy to be able to answer these questions, and as you write to your supervisors with more questions, we may be able to make more videos with more answers. I hope this has been helpful. Please be well and stay safe.